I'm about to lose my mind. You've been gone for so long. I'm running out of time. I need a doctor. Call me a doctor. I need a doctor to bring me back to life.
Did I just hear someone say, I need a doctor? Oh well, the doctor is in.
I cross the void beyond the mind, the empty space that circles time. I see where others stumble blind to seek a truth they never find. Eternal wisdom is my guide. I am the doctor.
Okay, so I am adjusting my stethoscope, adjusting lab coats, adjusting my pen, adjusting my notepad. Okay, I think I'm done adjusting. I know I'm done adjusting. Well, the doctor is in. So y'all have got consultations with me. Gather around. It's time to talk about your health and your total well-being. Hello, good morning. It's another fantastic day that the Lord has made. It is Monday. I mean, who is not happy? Who? Nobody? Well, good. Everybody has got to be happy. It's Monday. And besides, the doctor is in. Anything that has to do with your health and total well-being right now is absolutely of topmost priority and topmost concern. Yeah. All of Merriman's Vicalonia, of which at the moment I am Dr. Vicalonia. And this is your number one online health program, Doc Talk, where we get to talk about your health and your total well-being. And it is right here on your number one online radio, solely here for your listening pleasure, Vicalonia Radio. Great. So all those screaming, I need a doctor, come here, doctor, I need a doctor to bring me back to life. What? You've not heard a doctor sing before? Okay, so let's be serious. Straight up to what exactly do we have for you today on Doc Talk? The last time we were on the show, we talked about amnesia. Yeah, part 1 of amnesia, where we looked at the meaning of amnesia, the symptoms of amnesia, and the various types of amnesia, where we got to know about anterograde amnesia, retrograde amnesia, Winnie-Korsakoff psychosis, and children's amnesia, other types of amnesia that we actually looked at. And then we looked at the various symptoms of amnesia. We looked at all that. And I told you that when next we come back on the show, Doc Talk, we are going to be looking at the causes of amnesia and other stuff we need to know about amnesia. So that is what we are going to be looking at today on the program, Doc Talk. But before then, you know me, I never always cease to ask you this question. Do I go ahead and bring the action?
Bring the action.
Alright, because you're ready, then I am ready to go ahead and bring the action. Because you know me, I always love to do that. So, moving up straight to amnesia. Yeah, amnesia. Today we are going to be looking at the causes of amnesia. Yeah, we're also going to be looking at the diagnosis of amnesia and the treatments for amnesia right away. So, without wasting much time, because it's quite a broad topic and I'm really hoping that we'll finish it up today. Without wasting much time, what are the causes of amnesia? If you know you missed the first episode of the program, it is still right there. Please, you just go there, click on it, because it's not going to be there by tomorrow. Okay, because our program's on after 24 hours, they are off. All right. So if you know you missed the first part of amnesia, the first part of the topic, amnesia, the first show, just go down right there, okay? Just scroll down. You're going to see it there. I had to, purposely leave it there again, for you so that you don't miss it. But it's not going to be there by the end of today. All right. So, causes of amnesia. Now, any disease or injury that affects the brain can interfere with the intricacies of memory. All right. Memory function engages many different parts of the brain simultaneously. Damage to the brain structures that form the limbic system, such as the hippocampus and the thalamus, can lead to amnesia. These are parts of the brain that help you with your memory and thoughts, right? Great. So when those part of your brains are affected or disturbed by trauma, they could really lead to amnesia. Now, the limbic system is what controls our emotions and memories, okay? And when it's affected, what happens? Memory is gone, amnesia in. All right. Now, what are the causes of medical amnesia? Because we have medical amnesia. What are the causes of medical amnesia? Medical amnesia refers to amnesia caused by brain injury or damage, and the possible causes are stroke. Number one, stroke. Stroke could be a cause of medical amnesia, and then we have encephalitis. Encephalitis, okay? Encephalitis is a brain inflammation. Now, this can be caused by viral infection, such as herpes simplex, or an autoimmune reaction to cancer in another part of the body. Okay, so herpes virus could actually cause the encephalitis amnesia, which could lead to amnesia. And then it's also we have the autoimmune reaction to cancer. If you had cancer in some other parts of your body, okay, it could actually lead to that particular brain inflammation. All right, and then we also have celiac disease. Although no clear link has been completely agreed on, researchers report that people with celiac disease, seek medical help for amnesia, confusion, and personal changes. I told you that amnesia leads to confusion and personality changes, okay? And then when you have when a patient who has gone through celiac disease tends to have the medical amnesia. Okay. All right. And then we also have oxygen deprivation. Any illness or situation which undermines the supply of oxygen to the brain, such as a heart attack, respiratory distress, or carbon monoxide poisoning, all these that make it very impossible for oxygen, to be part of for oxygen to circulate around the body. When oxygen is deprived, then it could lead to amnesia, because when oxygen cannot get to the brain, things begin to happen. Negative, bad things begin to happen. All right, and then some medications such as sleeping drugs like Ambien, could cause medical amnesia. It could affect the brain, which could lead to medical amnesia. And then we have subarachnoid hemorrhage, which is bleeding in the area between the skull and the brain. Bleeding in the area between the skull and the brain could lead to medical amnesia. That's a trauma. That's a brain trauma. Okay, and then we have what we call a brain tumor that lies in a part of the brain that is important for the memory. When there's a brain tumor in the part of the brain that is very important for memories, it could lead to amnesia. Okay, and we also have seizure disorders that comes from dementia. Okay, and then we also have the electroshock therapy. This is a psychiatric treatment in which seizures are induced for therapeutic effect on anesthetized patients. Okay, some patients in mental health institutions go through electroshock therapy. It helps to boost up their brain, but it could lead to medical amnesia if a trauma comes from that. So the memory loss is nearly always temporarily. It's a temporary stuff, but there's some very rare cases where it is not temporary. Okay. All right. So, if you're just tuning in, this is Vicalonia Radio, and the program is Doc Talk, where we are talking about your health and total well-being. And today's topic, we are looking at the part 2 of amnesia. All right. Head injuries such as those that occur in car accidents can lead to memory problems. In most cases, the amnesia is not severe and it's not long lasting. Now, what are the causes of There's also psychological amnesia. We just looked at medical amnesia. Now we're going to look at psychological amnesia. This psychological amnesia is also known as dissociative amnesia. This is caused by emotional shock, such as being the victim of a violent crime, sexual abuse, child abuse, being involved in combat like soldiers, okay, being involved in natural disaster, being present during a terrorist attack. A lot of things can lead to dissociative amnesia, which is also psychological amnesia. So in simple terms, any intolerable life situation which causes severe psychological stress and internal conflict can lead to psychological amnesia. So in general, amnesia caused by psychological stress, okay, they disrupt historical memories, and rather than interfere with laying down new memories, they just destroy what you already have. Great. So how exactly does a doctor diagnose amnesia, or how is amnesia diagnosed? Stay with me, don't lose it. All right, how is amnesia diagnosed? Now, initially, a doctor would need to rule out other possible causes of memory loss, including dementia, Alzheimer's disease, depression, or a brain tumor. Now, when he has discovered that none of this is actually the cause of whatever is causing your memory loss, then the doctor will require a detailed medical history. This may be difficult if the patient does not remember things. So family members or caregivers have to be present in order to answer the doctor's questions. Now, a doctor will need the patient's permission to talk about their medical details with somebody else in order to help. Now, the doctor will also cover issues like, can the patient remember recent events? Okay. When did the memory loss problems start? How did the memory problems evolve? Were there any factors that may have caused the memory loss, such as head injury, surgery, or stroke? Is there a family history of any neurological or psychiatric diseases or conditions? Details about the patient's alcohol intake. Is the patient currently on any medication? Has the patient taken illegal drugs such as cocaine or heroin? Are the patient's symptoms undermining their ability to look after themselves? Does the patient have a history of depression? Are the patient's symptoms does the patient have a history of depression? The physician may also have to carry out this physical exam, like reflexes, sensory functions, balance, and many other aspects that has to be looked into when it comes to the brain and the nervous system. And also the doctor has to also check out the patient's judgment, short-term memory, long-term memory. It could also lead to an MRI scan, which is a machine that is used for magnetic field and radio waves to create detailed images of any part of the brain. A CT scan, which is also a medical imaging method that employs tomography. And what is tomography? Tomography is the process of generating a 2D image of a slice or section through a 3D object, okay? And then we also have the electroencephalogram. This actually provides an image of the brain while the patient is performing a cognitive task, okay, a task that requires thinking. Now, this particular method is used to help find out what exactly is going on with the patient while the patient is going through some thinking processes. So treatments for amnesia, well, there are currently no drugs for restoration of memory in patients. There are no drugs for that. But like I told you earlier on in the first part of the show, some patients who go through amnesia actually come out of it, regain their memory without really much treatment, okay? But then in any case, the doctors know what to do. They after going through all that diagnosis and tests and all that, they know what to do to help you out. But there are no drugs to regain memory. But amnesia can be well managed. You have to be around friends and family and loved ones. All right, it's been so great with you. That's all I've got for you right here on the show, Doc Talk. I do hope that you have been well educated and you are now aware and now more knowledgeable about the health condition called amnesia. All right, with that, I'm going to be signing out of the program. And trust me, I do hope that you have enjoyed yourself, because I have enjoyed myself. And do have a lovely day, because I love you and I know you love me too. Stay tuned. More stuff's coming right here on Vicky Lonia Radio. Don't go nowhere.
I cross the void beyond the mind, the empty space that circles.